Hey y'all, what's going on? This is Jackie Marie of J. Marie Booklet. So today I am making a video about what's going on in the world. You know, New York, they said, look, if you ain't got this vaccine, so it's just one of those things. Look, you're gonna hear me in this video throughout this whole video saying we just gonna sit back and watch. We're gonna sit back and watch. Look, we all know how this gonna end. Okay, you know, and I know how this gonna end. But we're gonna sit back and watch. We're gonna let them do what they do, and we're just gonna sit back and watch. So New York, last I heard, maybe 94,000 employees, healthcare workers, got the you ain't got to go home, but you got to get up out of here. They got that now. I think some facilities may be putting people on unpaid leave instead of really firing them. So we'll see. So one of the things that the governor, I think her name is Governor Hochul. I don't know. I think it's Hochul. She did an executive order to call the National Guards to help out, you know, in the shortfall with the staff. Also talking to the State Department about bringing in people from other countries, healthcare workers from other countries, Philippines, all over the place to help out. And then as well as asking people who have retired to come back and work. And then, you know, of course, you know, we got to throw the new grads to the wolves. You know, new graduate nurses, we got to throw them to the wolves. You know how they go. You know how they do it in the hospitals. So we're gonna see how this play out. You know, we're gonna see how this play out. We all know how this gonna end. You know, and I know. Now, if you don't know how it's gonna end, then you know I'll tell you in another video how it's gonna end. It's not gonna be good. You already have medical facilities canceling procedures, postponing procedures. You know, elective procedures, closing departments. I made a video about the maternity department that the hospital had to close the maternity department because they had staff quit and they didn't know what else was going on, who else was going to throw them deuces up. So, you know, you already have hospitals making contingency plans on what to do. And this is just New York, but you got hospitals all over the country making plans because hospitals have already been mandating the vaccine. So now some states, so like say a hospital, like you got governors fighting it. So like here in Florida, okay. Yes, we know what the president said, but it ain't going down up in here, you know, for now. Same thing in Texas. But then you have governors who are going along, who are doing it, you know. So New York was first. California probably be next. No other states, but those two, maybe Washington, Oregon, we'll see. But you already had hospitals mandating that their employees get vaccinated. Like the first hospital in Houston, I think they were the first ones, and they fired, I think they ended up firing 100, I think it was down to 120 because they suspended 170, but I think they ended up firing 120 something. So people are willing to walk. I got an article, reading an article. This hospital, let me see what hospital it was. Let me call them out. They did a survey of their employees. So it must be a humongous hospital. Because when they did the survey on if it was mandatory, would you stay or would you leave? Let's see, hold on, let me get it. 900 employees would throw them deuces up. Hold on, let me see if I can find it. Y'all, I couldn't even print no more. I got so many tabs open on my laptop right here of all these articles. Yeah. Ballot Health decided against implementing a vaccine mandate after a model suggested that as many as 15% of nurses or 900 employees may quit if the system did. Okay. Ballot Health, Ballad, Health, wherever that's at. 900. Okay. They did a model. Okay. 900. So, you can't have 50 states fighting for the same Filipino nurse from the Philippines, okay? From Africa, from wherever, all around this world. You can't have 50 states fighting for the same. Okay, so we gonna see how this play out. We already know. Look, well, I'm just gonna sit back and watch because you can't have 50 states fighting for. You can't have 40 states fighting for people around the world to come work here in the hospitals. You can't. That don't make sense. So we're gonna see how this works. I'm just reading articles upon articles. Some places had, like, I actually read one, only one person quit. The whole, out of all the employees, one got fired. And then I'm seeing 400, I think, in a hospital in Erie, New York, or Erie Hospital. Let's see if I can find that. Hold on. They were looking at 400 people. Let me see. I got so many articles. Erie County Medical Center in Buffalo suspended. Now this is them suspended elective inpatient surgeries and has to stop accepting intensive care patients from other hospital over the mandate. Like, do y'all understand that? And it said curtailing some operations would inconvenience patients and hurt hospital finances, adding that the procedures bring in $1 million a week. So you already have facilities, they closing, like I said, they're postponing procedures, closing departments. I was thinking about the hospital. If I think the hospital here has like 6,000 employees, and that may be between the main hospital and then the other hospital they built. Honey, if 100 employees, first of all, they was already short. Okay, the hospital already short. That's why getting all that overtime. Hospital already short. They had travel nurses, they had a pool, and they had per diem. Now, some years ago, they got rid of the per diem because we're mainly really busy during the summer. I'm sorry, during the winter when the snowbirds are here. But then, all the snowbirds call each other on the phone, and then they get on the plane and they out of here. They get in their car and they gone. They go back to New York or Michigan or wherever they come from. Like, they all get on the phone call because they all leave at the same time and the hospital is dead. Like, so the per diem never really worked. The pool never really worked, especially like once they left. The summer is slow. And then, of course, being here in South Florida, you got all these hospitals. So if you're a travel nurse, you can get that money because you can work, you can take an assignment here, you can take an assignment there. You can have 2 assignments. You can work, let me phrase that. You can work 2 places. Okay? Because if you think these nurses are not employed at one hospital and then take a travel assignment to another, because I think you got to be like 50 miles away. I think you got 50 miles away from your home. They do. Okay? They get their money. So you got all these hospitals and you're a travel nurse, you got your pick, So we're gonna see how this play out. New York is the testing ground, and of course California is probably on its way to doing it. I know California is requiring that correctional officers and staff have to be vaccinated to go into the prisons. So anywhere in California. So if you work for the correctional, then you got to be vaccinated. We have firefighters, police, unions. People fighting against this, and we're gonna see how this all play out. Because if you got medical workers fighting against this and willing to leave their job, lose their job, and push back against this, you mean tell me you don't think the firefighters do the same thing? You don't think the police will do the same thing? Because the teachers trying to do the same thing. Everybody's trying to do the same thing. They trying to take that. So we're going to see how this play out. We're going to see. But y'all, it is so many articles. I can't even tell you. But like I said, we're going to see how this play out. So let me know what's going on at your hospital. If you're in New York or California, or you work for a hospital that mandated it, how many people left, or how many people stayed, what's the percentage? Let me know in the comments below. You can also follow me on my blog. It's Jamie Reed Booklist. That's where I talk about being a health unit coordinator. And I'll talk to you later. Bye.